Whew.
I didn't label my. That's okay. Hi.
It's okay. Hi.
How are you guys?
We're
gonna wait
tired.
until everybody gets on. We gotta stop saying it. We can't lead the conversation with that every Friday.
We're feeling great.
Is it great?
It's Friday.
I don't know why.
We had a great dinner. Why is there numbers there? I don't
know.
That's a code.
Did you do that on purpose?
Not on purpose, but I did do that.
Okay.
So hi everybody. We're on a little bit late tonight. It's 9:30. We've had a long day.
3 4 5 6 4 3.
And it's a code.
It's right.
We'll have to use it like maybe if we play the lottery or something. And we're gonna make this short for a couple of reasons. We're working really hard. I say we, but what I really mean is Montika. I'm support, but she's been working super hard at getting the Lift Every Baby going, which is in 2 weeks from tomorrow at Foolish Things Coffee from 1 to 4. Charlie Red's going to be there. There's lots of giveaways. You can attend virtually or you can attend in person.
Now we got some cool stuff. So
we do.
I have just secured two gift certificates to Alan Gunther. He's
great.
An orthopedic
for body
massage therapist.
Mm-hmm.
And I've had massages, but what Alan does is he will rearrange.
He's great.
It's it is completely different than just getting, your standard deep tissue massage or lomi massage or spa massage.
It's different.
It's more medical than anything.
And I tell people I don't even call it massage sometimes. I sometimes say body work because he is great.
Yeah.
So if you got two, and we've got more things coming. So you guys, please join us. It's going to be so much fun.
And you can get the gift certificates and stuff we will be giving away there, but then we'll also be saving some for online. So since I have two, I'll probably give one away to someone that is attending live and then give one away to someone that attends online. Yes. But you want to make sure that you're checking in with us and watching the whole thing, because if you want to win from online, you'll have to identify something, that's happening or whatever.
And this is going to
It'll be fun.
And that will be 2 weeks from tomorrow.
Uh-huh.
It is going to be great. I'm hoping the weather will be great. It's going to be outside. So check
thermal bags and all kinds of stuff.
Oh, it's great. So I'll post things on my Facebook pages, Instagram, and so will Montika. And so that way you guys can get information, or you can, if you don't find, you'll find it. You can join.
Yeah. And if you want to just go and get your tickets, you could go to our website, and it is tfwok.com. So Total Family Wellness OK. tfwok.com. And if you go to the outreach page, hi Dee Dee, you'll be able to get your tickets there and read more about our nonprofit and everything. We have some amazing vendors that are going to be there, and it's just going to be a really good time. And yes, I've had some people asking me about masks and things like that, even though it's outside. And you will be able to socially distance, if you're comfortable, if you feel better wearing a mask, then wear a mask, you know what I mean? But it's also going to be super duper hot. So as long as you're outside and you're able to social distance, then I believe the way it reads is that it's okay, that you don't have to keep it on. But if you go inside of the building, to use the bathroom or anything like that, you gotta have your mask on while you're inside. But again, if you're eating, then that's okay to have it off, but you would be taking it off while you're eating. Yes. So we are gonna have a ball again. We have a ton of things to give away.
And if you want to participate in some kind of way or help support, you can donate. You can. There's go to the website Montika just said
tfwok.com.
Yes.
Yeah, and then again, it is National Breastfeeding Month, and then last week, or actually we're still in Native Breastfeeding Awareness Week, and when we're talking about native breastfeeding, there are, I believe it's less than 5%. It might be 1. I would have to ask Jasha. But there are not very many indigenous lactation providers. And these are just things that are really, really important to know and to understand when you're talking about cultural competence, and really understanding how important it is to have providers that understand the culture that you come from and that are on that same wavelength and things like that. So we would love to have you guys. You can learn more about, what we're doing as far as making change to help bring more providers of color, or just more ethnic providers, from Burmese to Black to Native American to Vietnamese. I don't care what it is, but it's really important to be able to relate, understand, even verbally, your healthcare providers.
And I think having someone in Montica has some great information. We won't be able to, divulge all of that tonight, but if you look on the website, but wanting to have programs to train up more providers that come from the community, because if you go back into that community, it's your community.
Yeah.
And so there's a lot of benefit to that.
It is.
There is, and we need more of that.
We
do. And it's really interesting. We had this discussion, and then we're going to talk about thyroid. We'll talk about thyroid, but we were talking about how. I lost my train of thought because I had to tap my screen.
Oh, yes.
We'll talk about it later.
Yes. So we're going to talk about thyroid, but it's super important. And getting people trained, working with your community, having representation to me is also a big thing.
Yes.
So when you go into a home and you see these young girls, and even young men, whomever, to be able to look up and say, wow, I could do that, or I want to do that. I want to be that person to help out, and so on and so forth. Community nursing is so big and so important, or community medicine, you know what I mean? In my opinion, I feel like we've gotten, so far away from that, but I think there's a lot lost.
Well, and that's one of the things that we were talking about too, is like we really need to make breastfeeding mainstream again. And a lot of times that it is considered alternative, and I don't know how breastfeeding is alternative. And this is not to say anything negative if you formula feed your baby, but we have to get behind the education and the resources to be able to say that breastfeeding is, if possible, the first choice for most of us if we're making that choice, to where we can support that.
Yes. So those are, August 29th, and we would love to see you guys there. It's going to be from 1 to 4 in person and online. So right now we're going to just move over and talk about thyroid. I've had several clients talk to me about having low thyroid, having Hashimoto's, having different things that are going on that we want to address. So we're going to have Dr. Chrystal talk about that, and I will throw my 2 cents in here and there.
So one of the things with thyroid, it's one of the most common questions that I get, and I will say, as being an alternative healthcare practitioner, so I don't have a medical degree, I don't prescribe medications, so I don't have that traditional way of thinking.
So what do you have?
It's one of so I am a doctor of chiropractic. So
she is a doctor.
I am a doctor. I won't go into all of my education, but I'm able to interpret labs. I'm able to not request labs. What is the word I want to use? This is
order lab.
Order lab.
Yes.
Order
your
labs.
Phone doesn't work.
I know.
It doesn't want to.
It's Instagram.
It's only your phone that's doing it this time.
It's Instagram.
Yeah. It's also got poor connection. I think that's probably what it is.
Yes. Okay. And so it's one of the most misunderstood things, and it shouldn't be. It's actually there is a complicated process to
and sweet and humble, but she's a nurse, she's a doctor of chiropractic. She's done functional medicine and worked in that practice for a long time as well, so she has a lot of experience. She has a passion for nutrition, and gut health, and all those different types of things, thyroid health, adrenal fatigue, and so she just is just a blessing to have, with our practice. So I just wanted you guys to know a little bit more about her, because I feel like chiropractic is big, right? Just like being a medical doctor is big. You could be anything within that, and I work with some amazing chiropractors,
and we all do something a little different too.
Yeah.
And so that's why just saying that doesn't always quantify quantify what I do.
Right.
And I do love what I do. I think I need to get close to you.
Sorry.
I do. Oh, you're good. I do love what I do, and I do have quite a bit of experience in it, and for a while learning about this. But with thyroid, one of the things is a lot of times people will say, I think I have low thyroid, or they have low thyroid, And so it's like, how do you know? Some people will be on medication. They'll ask, do I need to be on medication? And to be honest, when I look at thyroid, I'm not going to just look at thyroid. I'm also going to look at a big picture, because there's other things that can affect the thyroid. So some symptoms, and this is not all encompassing, but some very general symptoms of low thyroid can be low energy. Well, there's so many other things that can be low energy as well. So we need to find out why. So the goal of anything that I do is to find out the real problem of what's going on. It's not just to assume you have a thyroid issue or assume you have a hormone issue and just look there. We want to look at the big picture, because everything affects everything. And so one of the things that I will do is I like to do basic labs.
Right.
And so with thyroid, so basic labs for me is a little bit more than basic labs if you go to a traditional medical doctor. Now, it depends who you go to, but a lot of times I look at everything, and then I start putting the puzzle pieces together, where a lot of times if you go and you say, hey, I have headaches, they're going to look here. Hey, I have low energy, they're going to look here. And then if that's okay, then they're going to look here. I just like to look at everything and say, let me put this picture together of what's going on. And then I also history. So what has happened since birth, sometimes even before birth, and we can talk about that all the way up into that time. Stress levels are all going to be things that I look at. But if we get into thyroid, Montika mentioned Hashimoto's. So I'll talk about that in a little bit. Hashimoto's is an autoimmune thyroid condition. So it's an autoimmune disorder that affects the thyroid. We actually, if you have Hashimoto's, you're producing antibodies that could be destroying the thyroid.
Okay.
And so there's other markers that we can look at that as well. So when I do some basic labs, and we can talk about labs more, I like to do what we call like a chem panel. And most medical practitioners of any sort knows what that is. I mean, you know, as a nurse, you know what a chem panel is. It's a basic. It's looking, and then I also like to look at kidney function on top of that.
Okay.
So, and then I also like to look at a CBC, which is a complete blood count, which is looking at your red blood cells, your white blood cells. We can go into a differential and do more, but that's really basic. We want to rule out anemia. I like to look at ferritin and iron. We want to rule out anemia. We want to rule out any of these things that are actually can be fairly common that can be affecting. The other thing that I do like to look at, it's not a primary lab that I do, is looking at nutrient deficiencies, because a nutrient deficiency of iodine and some magnesium and some other things can also affect the thyroid as well. Okay. So we want it, because how great would it be is, I'm not getting enough iodine and that's what's affecting the thyroid instead of being on thyroid medication. It's not always that simple, but it can be that simple. We need to rule it out. So for thyroid, what I like to look at is, so typically what the standard has been is just looking at TSH, which is thyroid stimulating hormone.
Okay.
And if it's high, past a certain number, let's say, oh, you have low thyroid, and if it's low, you have high thyroid. It is much more common to have hypo or low thyroid function than it is to have high thyroid function. And there's a range. And so we won't talk about that. That's something that you need to talk to a practitioner about, because you can't just say, this is my number and this is what it means. You have to put it in context of the whole picture. Okay. So TSH is something that I would look at. I would also look at free T3 and free T4. And then I would also look at reverse T3. It tells you how well you're converting.
Do those come standard on?
No.
Okay. I know. I was wanting to say that.
Oh. No. A lot of doctors are now doing free T3 sometimes. Okay. Or free T4, but to me, you're still missing the picture. If you don't do all of these, you're missing the picture.
So if somebody came to you and all they had was their TSH, then, and they said, well, this is low, would you tell them that they should get these other ones as well?
Yes, I would. I would say, there are practitioners that would prescribe medications just on that, but there's also symptom correlation too. You know, if you're not having a lot of symptoms and it shows up, you're not just going to automatically want to medicate somebody, or there's other things before medication. I can't prescribe medications, but I can. A lot of times they're not even to the point to get medication.
Right, because a lot of times things can be managed with a lot of my mamas with herbs or different types of nutraceuticals or supplements and things like that.
And the thing is, even if you do have to be on medication, those things are still very beneficial. The other things I like to look at, I like to do this, and it just depends on the practitioner. This is not as cut and dry. I almost always like to look at thyroid antibodies. There's two that I typically look at. It would be anti-TPO and anti-thyroglobulin.
What's that? Or is that a lot? What's a TPO? What's TPO?
Thyroid anti-thyroid peroxidase.
Okay.
And so those are two antibodies that we can produce that can cause issues with the thyroid. Now, you can have elevated antibodies. You can have elevated antibodies but not have the full-blown disease because you don't have the symptoms and your thyroid levels look good.
Oh, okay.
So this is why it takes someone who really understands it to be able to say what to do. And I will tell you, I have talked to so many patients that have been to different practitioners, and a lot of us have different views, and so it's hard because of course I think I'm right. I think I know what I'm talking about, and I feel like I do. I think I give good advice on what to do overall, and I have other practitioners I've worked with that we correspond that together that would say yes, but at the same time is they'll go somewhere else and say that. Like, I'll give an example. I had a patient that come in. She was told she had Hashimoto's, and she was immediately put on thyroid medication. So after I did her history, but she was feeling horrible on the thyroid medication. So after I looked at her labs, this particular physician, one of the thyroid antibodies, there's a range, and if you have a thyroid antibody above 33 or 34, it's considered Hashimoto's in this particular lab. Or it could be you have high antibodies. She had 34. She had no other antibodies, and her thyroid levels were within normal range. She was given medication based on this, but her thyroid did not need medication, even though she had the antibodies, and her antibodies were really low. And what's interesting, we tested her again. I said, we just need to do another lab work because sometimes things, it's lab, it's not 100%. Her thyroid, she did not have Hashimoto's. And it's frustrating because now she went 8 months of this yo-yo feeling by being put on medication that she did not need to be put on. So thyroid, even though it should be straightforward and simple, oftentimes it's not. And then if we're addressing or not addressing it, can cause a lot of issues.
So I think, there's something to be said about, and of course we're not talking about if you're in crisis, right?
Absolutely not.
So if you
that's
are,
different.
That's a whole different, shebang. We're not going to be like, oh, you need some herbs if you are in crisis. You're
Correct.
past that point. But if you're borderline or something like that, and you're kind of like, to me, I base a lot of things on, how do you feel?
How do you feel? And then are you gaining weight? Are you not able to lose weight even though you're doing the right things? What are your hormones doing? How old you are? What's your stress like? One of the most common things I see with a borderline thyroid, is adrenal fatigue and adrenal issues. And if you're not addressing the adrenals appropriately before the thyroid, you're doing yourself a disservice. And with the adrenals, I do like to test. Not all people do. So that's something else you talk to a practitioner about, where you're at and what you want to do. But I almost always, with low thyroid or borderline thyroid or just not optimally functioning thyroid, is look at those adrenals. And I guarantee 9 times out of 10, if not 10 times out of 10, that the adrenal glands are involved. Because I don't know I have had people tell me they don't have stress. And there are people who don't carry stress. I've had a few that they have lots of money. They have a great relationship with their spouse. Their kids are grown. They vacation all the time. They have no worries, and they have a great life. That is not most of us, right? Most of us have some area in our life that we have a strain. So it's very common. But I'll have people say, "Oh, I'm not stressed," and they'll tell me all of the things. They have a loved one that is dealing with an addiction, and then they've been battling custody of grandchildren or children, and then they lost their job and they can't pay their bills. That is stress. All of those, one of those. And so all of us have,
or even getting a negative report
or
from
getting
your doctor.
Absolutely.
Can be another
Absolutely.
place, of stress.
Or if you just don't feel good. So if you're not feeling
then
good,
right now, you know what I mean, with the whole state of the nation and the virus and all the changes and all that, I feel like all of us are, pretty
stressed.
Spent.
And I just found something else out too, and I have to finish the webinar of this. There's some great things that are coming out. There's so much to stress and thyroid and things, but you can lose hair under stress even if you don't think, and it can take up to 6 months for that regrowth to come back. And so you're losing hair thinking you're not correcting the problem when actually it just hasn't gone back to that Yeah. So, and I can talk about more about that later.
Yeah, no, for sure.
But I think thyroid. So I really like, for a basic thyroid panel,
Okay.
I like to do TSH, free T3, free T4.
Okay.
And then I also like to do reverse T3, and then I like to do the 2 thyroid antibodies. The people who have no idea what thyroid is will not know, but some of the people who have had their thyroid tested will know what I'm talking about.
Okay. But would those be some things that, say, if somebody was curious or wanting to get labs, or it was suggested for them to get labs, that would be something that they could request? Can we also pull these or whatever?
You can, depending on how well your doctor is going to work with you, as if they're going to do it. Some physicians don't take lightly or take highly to their patients telling them what to order. I like to think that I work with patients. My patients come with a valid concern and they know something that maybe I didn't look at, or something. I'm more than willing, if I think if it's within reason, to do that for them.
Right. And then also understand that again, like she said, all practitioners are different, so if you're getting that check, in your spirit, that, or if you just want a second opinion, you know what I mean, or if you've been doing something for a long period of time and you're not seeing any changes, then a second opinion is not, a horrible thing to pursue. Now, I also don't feel like it's good to jump around. You have to do something long enough, you know what I mean, for it to work, right? Yes. Especially when you're not dealing with, again, when we're talking about crisis and we're talking about pharmaceuticals and things like that, you're going to be on a high dose where you're going to see an immediate change. But when you're talking about diet changes, getting rest, supplements, mm-hmm. getting outside, a lot of the things that me and Dr. Chrystal talk about, those things take time for your body to change and to adapt to those changes.
Your body didn't get there overnight.
Right.
You just didn't notice it until it got to a certain point.
Mm-hmm.
So your body took the beating for a while before we did anything about it. A lot of times, by the time we do something about it, it is like to the point where we can't take it anymore. And by that time, our ceiling of healing, hey, I just came up with something. Our ceiling of healing is probably lower.
Right.
And so the body is awesome. The body can heal. Our bodies are created, but we can abuse them and we can push them past what we need to do. And like what Montego was talking about even tonight, we are tired, but it is something that we have to say, okay, how are we taking care of ourselves?
Mm-hmm.
And we need to model that as well.
Yeah. So you gave the labs that you like to get. So when those labs come back, kind of talk about your.
So, and I will say this. So these labs that I'm talking about are typically done with serum or venipuncture. So this is taking your blood and sending it off. So most of the labs in any area can do those tests very, very easily. You can also have this tested in a blood spot, which is going to be the levels in your tissues, or urine. They don't really do thyroid in urine, but blood spot, and sometimes saliva. I like either blood spot or serum. Serum is perfectly fine for these. We can talk more about that later, like more in depth.
Mm-hmm.
I do, in a perfect world, I would like to do all the labs,
mm-hmm.
like all the serum testing we would need to do, all of the tissue testing we would need to do, and really put the picture together. Because if your tissue can show some levels, and then your serum can show others. Vitamin D is a prime example. We can do a serum vitamin D level, which a lot of your guys as practitioners would do. But then when we do a SpectraCell, which takes them from the lymphocytes, and we see how much your cell is actually getting, it can be different. And so that tells what's in the reserve and what's actually being utilized. And if there's a difference, why is there a difference and what's going on? So it's simple and complicated at the same time.
Right.
So with TSH, it just depends. I don't want to put out too many numbers, just because I don't want somebody to say, oh, well, it's too much comparison. So make sure you talk to your practitioner, but I can kind of go a little bit. So around like TSH, typically if it's above, I think 4, maybe 3 or 4, they'll say, oh, you have hypothyroidism. And then if it goes low, if you're on medication, it can suppress that a little bit down, and we don't want it too low, because that's that. So I like it around 1.5, somewhere around there. But there's a range. It doesn't have to be perfect. We're putting everything in context. Then we're looking at free T and free T and T4. So free T4, around 1.2, I really, really like. And then free T3, I like it about 3.5 or 6 or higher, even 4, but we don't want it to go too high. So it needs to be regulated in a really good range. If it's not, we need to see what other systems are going on. And that's why I really like to look at the big picture, because you can throw medication at it, you can throw supplements just for that, and it may or may not make a difference, because that's not the main issue that's going on to why.
Okay. So then with that, if someone has, what would some symptoms be?
Of low thyroid or high? Mm-hmm. Okay, so if we're just talking about thyroid only, not autoimmune brings a whole, unfortunately, other host of things.
Right, and they kind of sometimes run together though, right?
They all run together. And so does some of these symptoms. Yes, so that's why it's good to really get to because people say, I just have low thyroid, I'm just going to do this. Oh, it must be my hormones and this. We come to find out, it's not. And it's not all of those things, it's this over here. But being really tired is one. Right. Starting to gain weight and you're not quite sure can be another one. Hair loss can be another one. Low libido can tie into that, but that can tie into other hormone imbalance, as well as it can also tie into adrenals, right? Okay. So that's why I really like this, when we're talking about something like low libido, and just so people know, that means low sex drive. I have I have a patient that he didn't know what it meant, and it was just the funnest conversation, because I forget sometimes some of the verbiage that we use. It's like, what does that mean? But it can be from multiple things. And I talk to my patients pretty candidly, and I say, you don't have to tell me the details, but do you like your partner? Because your low sex drive might not be from your unhealthy body. It might be because you don't like the person that you're supposed to be having sex with, right? And that's a real, I joke about, but it's a legitimate issue. Because I will have some say, it's not good right now. So then we have to look at some other things. We want to keep the body healthy, but we want to keep those things in mind as well. But those are some of the main things. Is just,
so are those symptoms just for low, or is that for low or high, or what? Are there differences?
Yes. So high sometimes can be heart palpitations. Okay. Anxiety. Okay. Things like that, like more.
What's Graves'?
Graves' is autoimmune, but it's hyperthyroidism, high thyroidism. And so this can, if it becomes unchecked, your eyes get really big and round and bulging. So someone, and that one, to be honest, can be harder to manage when their thyroid is getting high. And you can go into crisis when you have Hashimoto's. Or Graves', you can go into crisis when they're doing what they call a thyroid storm. Okay. And so, and no answer is always perfect, meaning you can have an antibody, and just for the antibody itself cannot tell you if you have Graves' or Hashimoto's, or if you definitively have that. Okay. We have to have a picture in a clinic. So there's a lab, right? And then we have what we call clinical correlation. What's going on in you, that your symptoms, all of this stuff that can correlate with the labs to make sense.
So you said thyroid storm. Can you explain what that is?
Yes. Let's see if I can explain it well.
Okay. Explain it so we understand what you're saying.
It is a time when the thyroid will either, in a short period of time, get too high or get too low. Your heart rate, you'll feel, some people, they'll feel like they're having a panic attack. They feel like they can't function. It feels like they're going, and I've heard a lot of times when they're going through thyroid storm, a patient would say, I felt like I was going to die. And to be honest, if sometimes this goes on, it can go into crisis where you really need help, and it's where your thyroid is either overproducing or underproducing at a rate that is very alarming. Okay. And it can make you feel horrible. There can be it doesn't always have to be that extreme. But you have to if you have a thyroid storm, or you're working your way up to that, where sometimes I had a patient, he was young and he ended up having Hashimoto's. It was hard though, because it went from heart racing, agitated all the time, I can't sleep, all this stuff, to crashing and up. And so we had some windows seeing what was going on. but he was going to the doctors and everybody was saying it's nothing, it's nothing, it's nothing. And unfortunately it was something, and it finally got addressed. But it affected this young man. It had affected his erections and all of those things. And it was very, he's got, the last I spoke with him, it was getting balanced and much better. But that's very alarming for a early 20s young man to have to be going through for something that, that wouldn't necessarily be suspected in him. But if you have a practitioner that can know the symptoms, you can really quickly say, this needs to be checked quickly.
Right.
Yes.
Okay. You have to fill that up right now. So hurry up and do it.
So,
water break. No, you guys can share or get it out of something else.
So I think so those are crisis things that hopefully, to be honest, if it was me, if I'm having any mild symptoms, I mean, most of us, even though Montika and I, we're healthcare providers, we do lots of things to take care of ourselves. There's still things that we could do better.
Yes.
And but we go like I'm seeing another functional medicine doctor right now for myself, even though I would know how to treat myself, but sometimes I'm not my own best doctor.
Right.
And so that way I'm managing things that I'm seeing, and so that way somebody else can say, what about this, and let's take care of ourselves. Because I suggest anyone getting basic labs, have a baseline, see what's going on, because you will not feel bad always at first. It takes some time. So let's see what's going on first and go there. We can check thyroid and just say, I mean, I just think it's a really good way of managing your health overall.
I like it.
Yeah. Okay. And not being scared of your labs.
Yes. Don't be scared.
It's knowledge.
Don't be scared.
That's all it is.
So, no, that was great.
Thank
you have anything else you want to say about
I don't think
thyroid?
so.
What are we going to talk about next week?
I don't know.
Maybe
Maybe about labs, or we can talk about maybe even hormones a little bit.
Okay.
We can also talk about maybe the differences in some of the labs.
Okay.
And what that means, and maybe I can take some labs and kind of go through like why we need to go, and so what health means, because we were just talking about how we thought someone was healthy, and we see these people all the time, they have a heart attack, and you're like, well, they have a stroke or an aneurysm, and you're like,
yeah,
I thought they were healthy. And so
I hear a lot about that too, even with dealing with this virus and different things. You'll see somebody and they'll say, oh, well, they were a healthy person, but just because you look, a certain way, and then
but some of them have even been to the doctor and gotten labs, and they got a pass. I've had a patient, he was an older gentleman, but everything's perfect. Well, he kept having TIAs, which are transischemic attacks, and there's something going on.
Yeah, I've had some that have had chronic, either constipation or chronic diarrhea, and all of your labs come out okay, and so then you're okay, but you're not. And
but
so
you're not.
It to me, even with that, a lot of folks will say, oh well, Dr. Google isn't good, and so on and so forth. But I know a lot of people that have found functional medicine doctors, chiropractors, different people that are in these different types of work by doing the Dr. Google, which I don't really like calling it that, but when you're like, I've done all of the things this way, and I still have this issue, and
they are seeking medical care, and they're not getting any answers. And this
Right.
is what I tell my patients: there's always an answer.
Yeah,
There's always a reason. I don't unfortunately always know the answer, but I hopefully can help you figure it out, or help go in that direction, or point you to someone that may know what that is. But I've had, with very few exceptions, really good luck with, or the ability to find answers for people, at least to get them on the right path.
Right. And on the right path to feeling good, because that's the thing, right? You want to feel good. I feel like I've had so many clients that, think they're fine until we make some changes, and they didn't even know that they were in pain
or how bad they felt.
Right, until they
good.
felt better, and they're like, I didn't even know that, because you've existed with that for so
and
long.
age is not an excuse not to feel good.
No,
it is not an excuse.
No.
I feel better now than I did 20 years ago. I feel good I feel great most of the time. Yeah. Fatigue is probably the hardest part, but some of that's my own fault.
But I think it's relative. We can be, to me, our definition of health in this country is very skewed, right?
And that's the other thing.
And
it's
that's
they're
the problem.
healthy, but
a lot of times, you're not, because our bar for health is so low. Oh well, I'm fine. I have to take a few Tums or something. If you have to take Tums, if you have to take some sort of medication to keep you from having a headache or something like that, then that is an indication that there's something else going on that needs to be addressed, because we shouldn't be dependent on these things, even if it is over the counter. You know what I mean? Over the counter drug is still a drug. You know what I mean? And so those types of things are things that also can be addressed and that can be looked at, and we want to make sure that yes, we're looking at the whole picture. If you're not feeling good, we just you can reach out and figure out. Yes. It doesn't.
It's like an investigation. I like doing it.
Me too. And I tell all of my clients, all of my lactation clients, and those of you that have been with me know. My initial exam, I'm with you for 2 hours, but I'm also looking not only at you, I'm also looking at your baby. The one thing that I learned from Jennifer Tao is you heal the mother, you heal the baby. And that mom passes on, her trauma, her gut health, her everything she ate during that pregnancy onto that baby. And so we have to look, at both of you. And if there's something going on, I asked my moms, I said, when we're doing this, I need to know all the things that you don't think I need to know. Like, I need to know those things, so we get...
You'd be amazed,
from, are you skipping periods? Are your periods irregular? Are you having pain?
Yes.
You know what I mean? Those types of things, headaches, fatigue, weight loss, weight gain. She was talking about iodine. Iodine is big. When we're talking about milk production and those different types of things. And these can be just tiny little pieces of the puzzle, but they are so, they're huge, because it makes me sad when I hear moms come to me and say, well, the lactation consultant said, well, it's probably my hormones, and that's why I couldn't make any milk, so we had to stop. That doesn't mean that you have to stop. We can fix your hormones, and then your supply can come back. You know what I mean? So those are the types of things, that we can look at, or we can fix your hormones, fix your diet, do the different things so that you're in a healthier place for your next pregnancy, for your next, baby. So maybe it'll be easier for you to get pregnant, because, troubles with infertility and different things like that, a lot of, PCOS, all of those things play a role. Your thyroid, the Hashimoto's, all of those things play a role in your, like she was saying, your libido, to your abilities to get pregnant, to your ability to sustain a pregnancy, to your ability to your birth experience, what happens there, to breastfeeding, to, yes, I was able to start breastfeeding, but can you actually breastfeed for as long as you need to breastfeed, right? And that's at least 2 years. And, did you only make it 2 to 4 months? All of those things is relative when we're talking about, feeling good and those types of things.
And that's the thing too. I think the one thing that I find a lot, and you probably do this too, what is really sad and frustrating is when that these things, some things were possible, meaning having a breastfeeding relationship for that baby and that mom, feeling good, not having to deal with thyroid disorders, not having to do this, but they've been seeking information or not, and not knowing. And so then we make these decisions based on not knowing or getting not fully competent information. And I'm over here, it makes me sad, because I'm like, we could have been doing this. We could have this. Yes, you absolutely can help. One of my favorite things to see is someone, I don't like to see people who are not hopeful, but someone who is not hopeful, just with a little bit of information, is empowered now and like their lives are turned around because of one or two little things that made a huge difference, and then they can tackle some of the harder things.
Right, which is why a lot of the reason that we do these talks, right? Because we're dropping little nuggets in your ears. So if those things, resonate with you, they're just things that you can think about. You can call us, you can make appointments, you can come in to the office and you can see us. Those are the different things that we're going to look at and make sure that when we are, seeing you as a client, that we know that we are going to be, number one, treating the whole person. And that's going to be, mind, body, and spirit. That's a big deal. Y'all know I graduated from ORU, so that's it. That's, that is so important.
All affects
it's so
the other.
Important.
No matter what your belief is, that is a fact. You don't have to have the same spiritual belief we do, but you have that your mind affects the body, affects this, the soul. What did you say? My body, spirit.
I said mind, body, and spirit.
Yes,
it's
so they all affect.
Yes, they are all very, very important.
Yes.
And, again, of course, we see and will treat anyone, you know what I mean? But my point in saying that, what my baseline is, is Christianity, period. You know what I mean? And that is Dr. Chrystal's as well. But again, I have treated people that, are atheists. I have treated people,
I'll
take care of anybody, and to me, not to start preaching to people, but, Jesus loved everybody. So if you're dealing with somebody that doesn't want to see you because they say that they are, a Christian, I question that.
Because there's definitely
because God loves people,
and God created the body to function a certain way.
Right.
So a belief system. Now, if it's a negative belief, I'm not talking about like if you're a particular religion, but if it's a negative thought process, we got to address that.
Right. But if it's a negative thought process, still though, thinking negatively, even when you're talking about your brain and remapping and how those types of things, and people that, when you're talking about affirmations and things like that, those are still things that are positive things, positive. And if you are dumping negativity and continuously thinking, bad thoughts about yourself, bad thoughts about other people, or harmful thoughts, or harming other people, brain. It does. It changes your brain.
Pain changes your brain too.
Yes.
Physical pain. So when people think, it's just my whatever, physical pain actually changes your brain too. So we have to keep that in mind. It all affects. We have proof that it affects, no matter what your belief is.
That is literally what I think we mentioned that a couple of Fridays ago, talking about some research that came out, talking about your brain and laughter, and how your brain can't tell the difference between, a true laugh or a spontaneous laugh. If you your body, you making yourself do that, when you say put on a happy face and different things like that. With my teenager, and she smile, I don't feel like smile anyway. You know what I mean? Because
isn't it
those
like
things
when somebody
are
smiles
good
at
for
you
you.
not to smile back. It is yes, I agree.
And those things affect your adrenals as well.
We can talk about breathing.
I'm not talking about breathing with you.
Yes, because we actually agree. She thinks we disagree, but we agree.
Mm-mm. Okay, maybe one day if y'all want to see us bicker, then we can talk. we can talk about breathing. I'm not going there with
I
Dr.
trust our
Chrystal
friendship.
today.
I trust our friendship. It'll be
okay. So as we
okay.
Yes, we love y'all. We're gonna sign off. We will have another topic. If anyone has something specific that you guys want to talk about, or you have questions about, or something like that, we would love for y'all to, interact with us, shoot us, I'm not saying that. I cannot say that.
What?
I cannot.
You mean like come up in
no,
our DMs?
Yes, I can't. I can't shoot me a DM.
Don't shoot me a DM.
Something about DM just messes
just
with
don't shoot your shot in the DM.
No, we're not saying anything like that. You can send me an instant message, or perhaps
or a private message.
I don't need. I'm done. We're finished signing off.
Yes, we are.
You guys have a good night
Have a good
and an
evening.
awesome weekend. And I hope to see everyone, even if you can't make it in person.
In 2 weeks.
For those of you that are, far away, we will be here
At least good
online.
music.
It's gonna be
Giveaways.
fun. You can win some stuff.
Somebody
and
with
it's gonna
kids
be
and moms.
good.
Yes.
Yes, it's gonna be good. So we'll see everybody later. Thank you for
All right.
joining us.
Thank you. Bye.
Bye. I always forget how to end this thing. You got that one up there?